Come on.
You ready?
I'm ready. Let's do it.
Let's do it, huh?
Okay.
Today's the day. Let's make you look where you have, your best potential.
Yeah.
You ready for it?
Yep. The new me.
I remember when we talked, I told you I'm going to make you look 20 years younger. I'm going to try my best, okay? Your face, beautiful. Everything perfect. The problem, with your appearance, unfortunately, is you have the genetics that made your eyelids sag.
Yeah.
So we're going to make it go back up. And with that, you should get a huge improvement. Not only you're going to look better, you'll actually see better. A lot of the people we do surgery on, they say after you do that, almost immediately when they get up from the chair, they look around, they say, oh my God, the whole room is so much brighter. Wow. They really do, because especially when they drive, this part of their eye isn't covering them anymore. So it's not covered anymore. Right, so hopefully you're going to get a huge improvement. Okay. I'm just going to review with you what I'm going to do, and then we're going to mark you and just going to go. As you know, the skin is completely covering your lashes. You can't even see where your eyelashes are. And a lot of people complain that when they put makeup, they say my whole mascara runs over all my lashes and stuff like that. I can't even see my makeup. So that's one of the problems. And the other one is really a visual problem. It's kind of like these Italian restaurants. They have a balcony, shade over the balcony. So you're sitting there eating, you can't see the sky. Now if you lift that up, that really improves your vision. That's why you're here. So what I'm going to do, so I'm going to lift up your eyelid and find your natural crease. That's where your eyelid has a little line in it. And everybody has that except for Asian people. Asians don't have it. That's why they have the Asian eyelid. And for those patients, I actually make one. All right, so they look more, European looking. But anyway, so in your case, we're going to find that. I'm going to basically go from underneath this line here. This is all done by laser, so there's no blades, okay? Like that. And I'm going to bring this up all the way, pretty much up to here, okay? So you should expect a nice lift on the corner that will make it go up. Now, I'm not going to change the shape of your eyes. You have beautiful eyes. I don't have any reason to change it. If you wanted to, we could do that, but you don't need it. Your eyes are fine, okay? And the same thing here. It's going to go underneath this area, and it's going to come up all the way up to here, más o menos, okay? Now I'm going to make sure that when I do this, you're not going to sleep with your eyes open, because a lot of people would come to me, they say my surgeon takes too much, and when I sleep, my eyes are open. I had this lady who said my husband was talking to me this morning, and I wake up and I said, who are you talking to? She says, it's you. I said, but I was sleeping. He's like, no, you aren't. Your eyes are wide open. Well, we don't want that to happen. So
yes, please.
Eventually, and like I told you before, I'm going to improve the appearance of the forehead and the skin just by giving you a little bit of Botox, and that'll just get rid of the fine lines and stuff. You have dry skin, so it's a blessing and a curse because it wrinkles a lot faster. People who have oily skin don't get as much, okay? And last but not least, maybe later on down the line, if you like to improve the appearance a little bit more, get a little younger appearance, then I'm going to fill this areas up with a little bit of Juvederm or some kind of a filling material. It's basically collagen, you know what I mean? So we're going to fill this up and you'll be good as new. Later on in life, this part, you might want to lift it as well. So for that one, what I do is I just bring this and I lift it up, okay? You don't have too much fat prolapse. I'm sure you've seen people who have a lot of fat. You don't have it. You have a little bit. So if I want to do it, I'm going to just take out a little bit, and the rest of it I'm going to spread and fill up this area here. So whenever you want to do that, the incision, and you have these two little skin tags I'm going to remove. But what I'm going to do whenever you want is I will make the incision up. It's going to go under the eyelashes like this. Come down to here, and I'm going to make a little bit of an excision of the skin, maybe about 5 millimeters, 6 millimeters, something like that. Because if you do too much, then you're going to look like that. Okay. Then I'm going to reposition the fat a little bit, and when I suture back up, I'm going to connect this point to this point. So all of this is going to lift up in this general direction, the same way. Okay? So let's mark you up and rock and roll, baby. Rock and roll. So the first thing first, sorry, I keep lifting your hair because it's in our way. Look at me, honey, and say cheese. Right. So what that does is it shows me where the smile lines are. So I'm going to hide my incision inside that little crack. Close for me. Thanks.
You guys are both here for surgery?
Here's Tim, our anesthetist, and he's the one, the drug dealer, who's going to make you feel
I am the drug dealer.
high during the procedure.
I will give you some coke and rum. If you prefer something else, I'll give you something else.
As long as she's comfortable, I'm happy. Sorry.
Definitely. Okay, so you are. Which one are you?
Michelle.
Michelle. Okay. Couple quick questions here. My name is Tim.
Okay, hold on. Let me. We're recording.
Oh, shoot. Now come back.
Look at my nose. Huh?
So I just wanna wrap you up so you don't have to wait too long.
Close for me. Keep it close, keep it close, don't blink. Beautiful. Good. Look at me here. Say cheese again. Close, honey. So the incision is going to be hidden in this line. Beautiful. Now open your eyes for me. Look at me again. Thanks. Just like that. Close. Open. Good. Now, I check with a ruler and I measure every millimeter because a little bit of the difference is not acceptable to me. I want it to be perfect and symmetric. Go ahead and close for me, sweetheart. Okay, stop.